My name is Jamid Mohammad. Welcome back to my channel. In this radiology video, we are going to discuss about X-ray. So, how do we view a X-ray image properly? So, for suppose if we are having an X-ray in our hands, we should take that to a negatoscope, which is a device used to observe or view the X-ray images, and we are supposed to place this X-ray on that negatoscope properly and correctly, so that the image or the X-ray of the patient can be viewed correctly, easily, and properly. And if you can see here, there is an alphabet A written on the left hand side corner on this image. This image represents that this is the anterior view of the chest of a patient. So what we actually are viewing is towards the anterior side of the patient's chest, and this A alphabet is created on this X-ray using a radio opaque object. It might be an object that does not allows X-rays to pass through it, so that the medical practitioner can easily identify that this is the anterior side of the patient. And over here there is a letter L alphabet mentioned over here. Uh, this demonstrates us that this is the left side and this is the right side of the X-ray of the patient. And now, for every technique in the discipline of radiology, we are supposed to know the indications and contraindications in order to perform that technique. So as we all know, this is the X-ray. So indications of the X-ray are as follows. X-rays are basically conducted in order to identify the fractures or assess the fractures. For suppose if a patient has undergone a trauma or an accident, he or she might have broken some of his or her bones, like. So it would be easier for a medical practitioner if it's an X-ray, so that to find out whether are there any fractures happen inside the thoracic cavity of the patient or not. And in order to assess the joints or spinal diseases, a X-ray is suggested by a medical practitioner. And also cardiopulmonary diseases are are, are another indication in order to for a medical practitioner to suggest you to go for an X-ray. And coming to the contra introductions are the conditions in which a medical practitioner is not supposed to advise or prescribe the patient to go for an X-ray. Like as we have written here, as I have written here, pregnancy. In case of a pregnant woman, it is not advisable to go for an X-ray because of the dangerous waves that are getting emitted, which are X-rays. It's not good for and safe for the growing baby inside the mother's womb. So it's not advisable to go for an X-ray for a pregnant woman. And also for the patients who are suffering with bone loss, in which osteoporosis is a case. Like if he or she is affected or diagnosed osteoporosis, so it's advisable to not to go for an X-ray. And if the patient is having any kind of dental issues, then also it is not safe to go for an X-ray. As well as heart problems, because as we all know, in this technique we use harmful radiation waves to get the image of the internal organs of a patient. So let me explain the procedure of how the X-ray works actually. So here, if you can see, this is the device from which X-rays are emitted. So the person who will go for an X-ray is supposed to stand in this position. If it's an posterior anterior view, here this X-ray is a posterior anterior view X-ray. So in order to get an image like that, the patient is supposed to stand in this position. His face should be facing the screen, and his back, which is the posterior side, is supposed to be faced towards the device. So the x-rays are getting emitted from the device onto the patient's body directly on the on the posterior side, like the back of the patient, and these rays will go pass through all the organs, bones, and the soft tissues of the patient, and that rays will eventually fall on the screen with along the shadows of the organs, bones, etc., whatever is inside the thoracic cavity of the patient if it's a chest x-ray. And once we have successfully got the x-ray of the patient, it would be probably look like this. If there are no wrongs and we have performed the technique successfully, we will be able to get an image like this. And in order to say that that image has no defects, we should follow some criterias, like the resolution, density and sharpness of the image should be perfect. If we can look here, there are no blurrings or any disturbances in this image that will not allow or which is blocking our view. So it's a perfect x-ray, and there are no resolution, density and sharpness problems. Everything is fine in this, and there are also no rotations of the patient. Like if at the time of performing an x-ray, if the patient have shown some kind of involuntary or voluntary movements, then the x-ray of that patient will not be proper. So in order to consider this as a properly taken x-ray, we can see the clavicles of the patient. The clavicles of the patient should be right in exactly in this method. They should not go up or down, and there should not be any disturbances in the angle of the clavicles. And the distance between the medial side of the scapula on both the sides, right and left, and the spinous processes should be equal. Like if we can see here, this is the medial side of the scapula on the right side, and this is the left scapula's medial side, and these are the spinous processes of our vertebral column that we can see on this x-ray. So the distance between the right scapula and the spinous processes and the left scapula and the spinous processes should be equal. So by looking at this, we can declare that there are no rotations in the patient's body at the time of performing an x-ray. And the inspiration can be checked by using counting the number of ribs that we can see over here. This is the first, second, third, fourth, fifth, sixth, seventh, eighth, ninth, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So if there are less than 5 ribs that we are able to identify in the x-ray, then we can say that the patient's breathing is not proper, or like at the time of performing the x-ray, the patient has not undergone the actual required amount of inspiration, and so that image cannot be used for the further purposes. Like it could be under hypo inspiration condition, or if the number of rib cages are more than 9 or 10, it will be like hyper inspired x-ray, so it is not correct one. So we will be supposed to suggest the patient to go for another x-ray so that we can diagnose the problem accurately and properly. And this is the chest ray, and it's posterior anterior side view, posterior anteriorly viewed ones. Penetration of the x-rays is adequate, which is why we have got a perfect image of the x-ray of a patient. Now coming to the anatomical parts of the x-ray of the chest of a patient that we can look here in this x-ray are as I have told you already, this is the left and this is the right side of the X-ray. These are the posterior ends of the ribs and these are the anterior ends of the ribs. And this is the trachea and the major bronchi of the chest. This is the right root of right lung and this is the root of left lung. These are the ribs. This is the diaphragm. Here we can see their liver is located, and this round shaped marking or darkly marked ones is called as gastric bubble. And we can also view the right lower lobe of the artery as well. And now coming to the pulmonary field, the blue line which I have drawn here is the pulmonary field of the chest of a patient. This is the pulmonary field of the right lung and this is the pulmonary field of the left lung. And whereas coming to the segments of the lungs, every lung has 10 segments in humans. So here I have drawn 1, 2, 3, 4, 5, 6 segments, among which 7, 6 segments are not 7, 6, 9 and 10 segments are not able to view on the right lung because they will be seen from the posterior side. As we know, this is the anterior view of chest X-ray, so we could be able to see only the first, second, third, fourth, fifth and eighth segments of the right lung. And coming to the left lung, we could be able to see the first, second, third, fourth, fifth and eighth segments of the lungs. Coming to the sixth and seventh segments of the left lung, it will be visible from the posterior side of the lung. Posterior side of the chest X-ray or posterior side of the lung consists of the rest of the segments. And as far as discussing about the anterior side of the chest, anterior side of the lungs, these are the only segments that we can easily identify. And this blue line here is the ascending aorta, and the blue line here which I have drawn is the right atrium. The junction where these two lines meet is called to be as atriovasal angle. And the whole white thing which plays the major part of the X-ray is the shadow of the heart. And this is the aortic arch, arc of pulmonary trunk, eye of the left atrium, left ventricular arch. On the left, are located on the left side of the heart shadow, and on the right side of the shadow of our heart, we can probably see the ascending aorta, arc of the right atrium. And these thin hair-like lines which are in white color on this X-ray are the blood vessels of our lungs, and these two blue ones are the roots of the lung, right and left respectively. The width of them is equal to 2.5 centimeters. And these red markings that I have made on the either sides of this image are the cardiodiaphragmatic sinuses, and these blue lines that I have made on the either sides of this X-ray are the costa diaphragmatic sinuses. So that's it. All I would like to explain about the X-ray of chest. If the image here the image is like cropped, if the image is shown in a little bit extended version, if we can easily identify whether the X-ray is of male or female, because in female we can see the mammary glands or the breast markings clearly, so that it will be easy for us to differentiate whether it's of a man or a woman, male or a female X-ray image. So Thank you guys, thank you for watching my video till the end, and I would like to thank my professor Aigiram to letting me learn a lot in the discipline of radiology. See you soon. Goodbye.